Pneumonia is often called the old man's friend not because it's friendly, but because it silently takes too many lives among older adults. This lung infection can be particularly dangerous for seniors due to their weakened immune systems and other underlying health conditions, making it a silent threat that demands our attention. But here's the truth. Many cases of pneumonia can be prevented, detected early, and treated successfully if you know what to look for. Understanding the early signs, appropriate treatments, and preventative measures is crucial to protect our older loved ones from this serious health concern. In this video, we'll break down the early warning signs of pneumonia in seniors, what makes it different from a simple cold or flu, the best steps to take at home and in the hospital, and how to protect older loved ones year-round. We will cover everything from recognizing subtle symptoms to implementing effective prevention strategies, ensuring you have a comprehensive understanding of how to safeguard senior health. Let's make sure you know exactly what to do before it's too late. Timely action and informed decisions can make all the difference in managing and preventing pneumonia in the elderly. Pneumonia is an infection of the lungs, often caused by bacteria or viruses, that leads to inflammation and fluid buildup in the air sacs. This condition occurs when the tiny air sacs, called alveoli, become inflamed and fill with fluid or pus, impairing oxygen exchange and making breathing difficult. For healthy adults, the body usually fights it off. But in seniors, especially those over 65, the immune system is weaker, the cough reflex is slower, and underlying conditions like heart disease, diabetes, or COPD make recovery harder. Their diminished immune response means their bodies struggle to combat infections effectively, increasing their vulnerability to severe complications. That's why pneumonia can turn dangerous so quickly in older adults, and why early detection is everything. The rapid progression of the disease in seniors necessitates immediate recognition of symptoms and prompt medical intervention to prevent life-threatening outcomes. Here's what makes pneumonia tricky. In seniors, the symptoms can be quiet and confusing. They don't always start with a high fever or a bad cough, which are typical indicators in younger individuals. Instead, the signs can be subtle and easily mistaken for other age-related ailments or general malaise. Instead, look out for these early warning signs: sudden fatigue or weakness. They just seem off, tired, or uninterested in activities they usually enjoy. This unexplained decline in energy can be a critical early indicator that something is wrong. Rapid breathing or shortness of breath, even with light activity. Observe if they are breathing faster than usual or struggling to catch their breath after minimal exertion, as this can signal respiratory distress. Confusion or mental fog. This can be one of the first and most significant signs in elderly patients. A sudden onset of delirium, disorientation, or difficulty concentrating should raise immediate concern, as it often indicates a systemic infection affecting brain function. Low body temperature. Instead of a fever, some seniors actually get colder. This atypical response to infection, known as hypothermia, is a critical symptom to watch for, as it can be a sign of severe illness in older adults. Chest discomfort or pain, especially when coughing or breathing deeply. This pain might be sharp or dull, and it can indicate inflammation in the lungs or surrounding tissues, making even simple breaths uncomfortable. Coughing up phlegm or mucus. It might be yellow, green, or even rust-colored. The color of the sputum can provide clues about the type of infection, with discolored mucus often indicating a bacterial presence. These signs can appear suddenly, sometimes overnight, so if something doesn't feel right, don't wait it out. The rapid onset and progression of pneumonia in seniors mean that delaying medical attention can have serious consequences. If a senior shows any of those symptoms, especially confusion or rapid breathing, it's time to see a doctor immediately. Prompt medical evaluation is crucial to diagnose pneumonia early and initiate appropriate treatment, which can significantly improve outcomes. At the clinic or hospital, doctors can check oxygen levels, do a chest X-ray, and test for bacteria or viruses. These diagnostic tools help confirm the presence of pneumonia, identify the causative agent, and determine the severity of the infection, guiding the treatment plan. Seek urgent care or go to the ER if you notice. difficulty breathing or lips turning bluish, persistent vomiting or inability to eat/drink, chest pain, high fever or chills, sudden drop in alertness or confusion. These are critical signs of severe pneumonia requiring immediate emergency medical attention. Pneumonia progresses fast, especially bacterial pneumonia, so early treatment can literally save a life. The rapid multiplication of bacteria can quickly overwhelm a senior's compromised immune system, making swift intervention with antibiotics essential to prevent widespread infection and organ damage. Treatment depends on the cause. Bacterial pneumonia is treated with antibiotics, often for 5 to 10 days. It is crucial to complete the entire course of antibiotics, even if symptoms improve, to ensure the infection is fully eradicated and prevent antibiotic resistance. Viral pneumonia requires rest, hydration, and sometimes antiviral meds. Unlike bacterial pneumonia, antibiotics are ineffective against viral infections, so supportive care and specific antiviral medications, if available, are the primary approaches. In severe cases, seniors may need oxygen therapy or even hospital care to support breathing. Hospitalization allows for close monitoring, intravenous fluids, and respiratory support, ensuring the patient receives the intensive care necessary for recovery. At home, focus on plenty of fluids to loosen mucus and prevent dehydration. Rest. Recovery can take weeks, so adequate rest is vital for the body to heal. Humidified air to ease breathing and soothe irritated airways. Nutrient-rich foods, soups, broths, soft fruits, and vegetables to provide essential vitamins and energy for recovery. And most importantly, make sure they finish all prescribed medication, even if they start to feel better. Stopping medication prematurely can lead to a relapse of the infection and the development of antibiotic-resistant bacteria, making future treatments more challenging. The good news? Many cases of pneumonia are preventable. Here's how to lower the risk. Get vaccinated. The pneumococcal vaccine and annual flu shot dramatically reduce pneumonia risk by protecting against common bacterial and viral strains that cause the illness. Practice good hygiene, hand washing, avoiding sick people, and disinfecting frequently touched surfaces. These simple yet effective measures help prevent the spread of germs that can lead to respiratory infections. Strengthen the immune system, eat well, get enough sleep, and stay active. A robust immune system is better equipped to fight off infections, making a healthy lifestyle a cornerstone of pneumonia prevention. Manage chronic conditions, keep diabetes, heart, or lung disease under control. Effectively managing these underlying health issues reduces a senior's vulnerability to pneumonia and improves their overall resilience against infections. Encourage mobility. Even light walking improves lung capacity and circulation. Regular, gentle physical activity helps keep the lungs clear and strengthens the respiratory system, making it harder for infections to take hold. Avoid smoking or secondhand smoke. Smoking weakens lung defenses dramatically. The harmful chemicals in smoke damage the delicate tissues of the lungs, impairing their ability to clear mucus and fight off pathogens, significantly increasing pneumonia risk. A healthy lifestyle is one of the best long-term protections against pneumonia. By adopting a holistic approach to well-being, seniors can significantly reduce their susceptibility to this serious lung infection and maintain better health. Recovery can take time, sometimes several weeks. Seniors might feel weak or low in energy for a while, so gentle activity, nutritious meals, and patience are key. It's a gradual process, and rushing it can hinder full recovery. Caregivers should monitor breathing, appetite, and alertness daily. Consistent observation helps detect any signs of relapse or complications early, ensuring timely intervention and continued support for the recovering senior. And remember, if symptoms return or worsen, go back to the doctor. Relapses can happen, and prompt medical attention is crucial to address any recurring or new issues effectively, preventing the infection from becoming severe again. Pneumonia in seniors isn't something to take lightly, but with awareness, prevention, and early action, most cases can be treated successfully. Empowering ourselves with knowledge and proactive measures can significantly improve outcomes for our elderly loved ones. Share this video with someone caring for an elderly loved one. It could help save a life. Spreading this vital information can equip more families with the tools to protect seniors from the dangers of pneumonia. Stay informed, stay healthy, and take care of each other. Collective awareness and support are essential in safeguarding the health and well-being of our senior community. Subscribe for more health insights. Join our community to receive regular updates and valuable information on senior health and wellness.